Knock knock. Who's there? Type 1 diabetes. Type 1 who? Come. Let me open the door and introduce you to the management of type 1 diabetes. In type 1 diabetes, there is zero insulin production. These children do not produce any insulin at all. So the mainstay of the treatment of type 1 diabetes is insulin therapy. It's very difficult to start insulin therapy in children because of the fears that they have. But parents, please remember, insulin is safe, insulin is effective, and it is absolutely required for your children. Nowadays, insulin are available in pens and very easy to administer and very effective. We may have to give multiple shots of insulin up to 4 to 5 times a day in order to mimic the normal physiology in our body. Our body produces insulin in a 24-hour fashion and also produces extra boluses when we eat food. To mimic that, we need to give multiple doses of insulin. Depending upon the blood sugars, we need to monitor the blood sugars and adjust the dose of insulin accordingly so that there are no hyperglycemias or hypoglycemias. We need to maintain a constant good level of blood sugar, the targets of which your doctor will decide for your child. After having treated type 1 diabetes, some of these children over a period of few weeks to months go into a honeymoon period. This is the phase where the pancreatic beta cell function improves and the diabetes goes into a remission. It means it gets okay, but this is only temporary. The child is going to get back type 1 diabetes. This may last only for a few days to a few weeks and where the insulin requirement comes down. But don't be overexcited. Type 1 diabetes is a lifelong disorder and requires lifelong shots of insulin. Besides insulin, diet and exercise, as in type 2 diabetes, also forms the mainstay of treatment in type 1 diabetes. A nutritious, healthy, well-balanced diabetic diet formulated by the registered dietitian will formulate a diet plan for your child so that the sugars are well maintained with multiple meals and snacks. Exercise is very important because it helps to burn the calories and keep the sugar under tight control. A psychological support by the psychologist is very important, not only to the child but also to the parent, because the child then starts asking, why me? Of all the children, why it was me who got affected with type 1 diabetes? And therefore, constant psychological support is important. Type 1 diabetes is a lifelong disorder and therefore it requires a lot of patience, dedication and commitment. This is Dr. Prakash Pania, Specialist Endocrinologist, Aster Medical Complex. Thank you.